Cirrhosis of the liver is a serious condition where healthy liver tissue is replaced with scar tissue, preventing the liver from functioning properly. There are several signs and symptoms that may indicate someone is developing cirrhosis. Recognizing these signs early is important, as treatment at an early stage may help slow or prevent further liver damage. In this video, we'll go over the main signs and symptoms to watch out for. Fatigue and weakness. One of the most common early signs of cirrhosis is feeling unusually tired and weak. As cirrhosis progresses and more scar tissue builds up, the liver becomes less efficient at processing nutrients and removing toxic substances from the blood. This takes a toll on a person's energy levels. Fatigue tends to get worse over time, and people may struggle with physical or mental exertion that they previously handled well. Along with weakness, people may also just feel generally unwell or off. Pay attention if you constantly feel run down without explanation. Skin changes. Several skin changes can indicate cirrhosis. One is jaundice, which causes yellowing of the skin and eyes as bilirubin builds up in the blood. The palms may also become red, and spider veins may appear on the chest, shoulders, and face as pressure builds up in the liver. Additionally, easy bruising from minor bumps or scrapes can occur. This is due to deficiencies in blood clotting factors made by the liver. These skin signs are all related to the liver's impaired ability to remove waste substances. Abdominal changes. As cirrhosis advances, a variety of changes may happen internally around the abdomen. Fluid can build up, causing swelling and bloating. The area may be tender to touch. An enlarged liver or small lumps under the skin related to cirrhosis can also be felt. Another change is enlargement of the spleen, which is located on the upper left side of the abdomen. Along with fullness and distension, there is also the possibility of internal bleeding related to increased pressure in the portal vein system. Vomiting blood or having bloody stools are emergency warning signs. Appetite and weight changes. Cirrhosis often leads to shifts in appetite and weight. Some find they suddenly lose their appetite as the cirrhosis impacts liver function. Unintended weight loss over weeks or months without explanation can be an important warning sign. But others may actually gain weight due to fluid retention and abdominal swelling related to the liver disease. Pay attention to any unexplained fluctuations in hunger, eating habits, or weight, as they may reflect underlying cirrhosis, memory loss, and confusion. As toxins build up in the blood due to liver damage, they can affect brain function. This can lead to mental fogginess, trouble concentrating, memory loss, and confusion. People with cirrhosis may feel they are in a mental haze or not thinking clearly. The medical term for this is hepatic encephalopathy. It tends to come and go at first, but gets more persistent as cirrhosis advances. Spider angiomas. These small red blood vessels just under the surface of the skin resemble a spider shape. They are caused by circulatory changes related to liver disease. Spider angiomas can appear on the upper body, often the hands, arms, upper chest, shoulders, or face. They occur as the body tries to bypass the liver circulatory system by dilating these superficial blood vessels. Gynecomastia. In men with cirrhosis, breast tissue can become enlarged in a condition known as gynecomastia. This is related to an imbalance of sex hormones due to impaired liver function. The swollen breast area can be tender or painful. As fluid also accumulates with worsening cirrhosis, it can make the swollen breast tissue more pronounced. High blood pressure in the abdomen. Cirrhosis leads to increased pressure in the portal vein system that brings blood from the digestive organs to the liver. This portal hypertension can cause visible distended neck veins, fluid retention in the abdomen, and a risk of varices, enlarged veins that can rupture and bleed. Being proactive about potential liver disease risks is crucial to catch cirrhosis in its early and most treatable stages. Along with watching for key signs of liver trouble like fatigue, skin changes, abdominal bloating or pain, and appetite weight shifts, you can also take preventative steps. Avoid excessive alcohol, which can directly damage liver cells over time. Moderation is key. Be cautious with certain pain relievers, supplements, or other medications that stress the liver. Check with your pharmacist. Maintain healthy weight and blood sugar levels, as fatty liver disease often underlies cirrhosis. Exercise and nutrition matter. Get vaccinated against hepatitis A and B to prevent viral inflammation and scarring of the liver. Practice good hygiene and avoid infection risks that could further compromise liver function. Essentially, caring for your liver when it's still healthy buys you time if disease does start to develop later on. The takeaway message is this. If you notice one or more unexplained signs like yellowed skin, abdominal bloating, or constant fatigue, see your doctor promptly. Catching liver disease early on and getting the right treatment can preserve more of your liver function. Being aware of common cirrhosis symptoms allows for earlier intervention, which ultimately could save your liver from further damage down the road.